Okay, welcome back. Episode 15 of Making Sense of Your Money. Today, I am super excited to have a special guest on with us. Her name is Paula Venné-Clendening. She is of Walsh Duffield, and she specializes in Medicare and individual product plans. So welcome. Thanks for coming, Paula. We certainly appreciate it.
Well, thank you. I'm excited to be here.
Awesome. So we got a lot of questions today.
Okay.
I think this is something that our clients and people that we work with have so many questions on Medicare and insurance, and there's a lot of noise out there. So hopefully today we can make some sense of things and bring some simplicity to maybe a complex situation.
I
So
always tell my clients I try to keep things as painless as possible. That is always my goal.
Perfect. We're on board for that today. So let's get right into it. The first question that I have for you happens to be, what just happened last month, August of this year. President Biden announced a passage of the Inflation Reduction Act. And a big part of that was targeted at lowering prescription drug coverage for people on Medicare. So what can people who are on Medicare expect, in regards for, are they going to start saving money right away? What does this mean for them?
Okay. Well, there definitely is a timeline, and we've been getting questions from our clients already. Like, is this $2,000? I hear that I'm not going to have to pay any more than $2,000. Okay, that's not in 2023. It's coming, but it's not in 2023. So you probably won't see a great deal of change for this coming year. A couple of important things to keep in mind. There is a cap on insulin prices. So that is a huge burden, financially for folks who are on insulin. And in the area here where we live, there are a lot of diabetics. So this could be a big cost saving. So prices on insulin are going to be capped at $35. Now, that doesn't mean that every insulin is covered on every insurance company's formulary. So while it is good news, if you are taking insulin and you're on a Medicare drug plan, you want to make sure that the particular brand of insulin that you're taking is on the formulary for the company that you want to go with. Another thing that is coming into play in 2023, they are trying to keep prices from raising on drugs faster than the rate of inflation. So there will be penalties and fees to pay if a drug company is trying to raise drug prices out of pace with the rate of inflation. The $2,000 out-of-pocket maximum for drugs, that is going to come into effect in 2025. So stay tuned for that. But in 2023, those are the two big things: is the cap on insulin and the inflation rate as it plays in with drug costs.
Okay. Yeah, that's great. Great information. I think what's coming too, even in 2025, could certainly help a lot of people.
Oh,
So,
sure. Yeah, definitely.
so number two I got for you today is I know our Medicare eligible clients get an overwhelming amount of mail, right? Especially this time of year is Medicare annual election period.
Yeah.
And some pieces are important, but a lot of it just kind of looks like solicitations that try to look like official mail.
Right.
How do you sort through that all? Like, what advice do you have for people as they're getting all this, what they should do?
Okay. So first I want to say thank you, Mom and Dad, because my parents collect everything they get in the mail and they give it to me so that I can see it. So I know what people are receiving. And yeah, a lot of it is very sort of plain looking postcard type things. See if you're eligible for this and this, and call for your free guide. What you have to be careful of, and I really want to press this word of caution to anybody who's receiving these things in the mail: read the fine print. Okay. A lot of times what you're going to see, they're required to include this language, this is not from Medicare. This is a solicitation for your business, even though it looks very official and you think, boy, I want to see if I can save some money. I want to see if I qualify for this and that. Really what you're doing is you're giving your information to a broker who is then going to start cold calling you because you've inadvertently given them permission by mailing back this business reply card. And they're going to try to switch you into a different plan because it's financially to their gain. So my big thing is look at the logo in the return address. So if that logo is from Social Security and they're the folks who are going to be mailing out letters telling you if you qualify for the Medicare Savings Program or for the low income subsidy. They're the ones who send you your Medicare card. So something from Social Security, look for that logo. Anything from CMS, so that's the Centers for Medicare and Medicaid Services. They are the governing body over Medicare. So once you've enrolled in Medicare through Social Security, CMS is the one that takes over with processing claims and regulating the insurance carrier. So unless it is coming from one of those two places, or the Railroad Retirement Board, if that's who you get your retirement benefits from, it's probably a solicitation for your business. Read the fine print. Don't mail things back unless you know that it's going to somebody you actually know.
Got it. No, I think that's really important because it's scary, right? People don't know. It's a lot of information, and the last thing you want to do is open yourself up to getting more, right?
Absolutely.
More mail and
Absolutely.
more calls.
Yeah.
So
Or inadvertently getting put into a plan that you had no interest in.
sure. Yeah,
Yeah.
absolutely. So that kind of leads me to the next question I have, which
Mhm.
is, why is the Medicare annual election period so important? And, do plans really change that much from year to year? Is there anything that seniors should be doing to prepare for the upcoming plan year?
Absolutely. So not only do plans change and benefits change, but people change. So we work with a lot of folks. What our approach is with our clients is we will reach out to everybody that is with us and check in on them and say, hey, have you received your annual notice of change? So this is something, when you're getting all that mail, definitely something you want to keep your eye out for. So every year, your insurance carrier is going to mail you what's called the annual notice of change, or your ANOC. And that is going to detail anything that will be different with your plan going into the following year. It's important that you take some time and review that, because you may not realize that your specialist copay is going up $10, or you're losing your over-the-counter benefit or something like that. So you really want to review that and review yourself, okay? Because maybe in the past you were a snowbird and you were going to Florida for 4 months of the year, and you had a cardiologist down there, and you were in a PPO plan and you were paying a couple $100 because you wanted that flexibility. But now your health needs have changed, your family needs have changed. You're not going to Florida anymore. So you're probably paying more money than you need to for a benefit that you're not even using. So this is why it's really important to take the time and review your benefits and review, have your medications changed? Have your doctors changed? Has your lifestyle changed? And whenever possible, of course, we want to save some money and make sure we're getting, the biggest bang for our buck. And certainly, we see that dental benefits, things like that. Dental is so important to people. And you may find that, your plan's okay, but here's this other one that's got a really good dental program built right into it. So definitely worth the time to review.
How soon should people start reviewing? Like what time of
Yeah.
year is best for that? How long does it take to maybe switch plans?
Mhm. So you'll be getting the ANOC. Really, they're on their way. So they're usually in people's hands by the end of September. You're also going to be receiving the 2023 Medicare and You book. I've already pilfered my dad's so that I have it, because I like to read these things, because I work in insurance and I'm an odd duck. But the uh, the annual notice of change is really sort of your key to saying, okay, let me start gathering my information together and getting ready for open enrollment. The annual enrollment period begins October 1st. So October 1st is the day that people like me can start to talk to my consumers about the plans for 2023. We are not allowed to discuss the plans and benefits until October 1st. October 15th till December 7th is the window of opportunity where people can actually make a change to go into effect for 2023. So yeah, I mean, the homework process is really, it's starting now. And, anybody who works in the field as I do, our calendars will get pretty busy. So if you really wanted to sit down and go through things, by all means, make a call now and get on the calendar for an appointment to review your benefits. One thing I do want to throw out there is very important for 2023, starting October 1st. I mentioned CMS, the regulatory body that oversees the Medicare plans and brokers like me who work in this field. Starting October 1st, as a protection for all of the people that we work with, we are required to record every single telephone call that we have. So you will be told at the beginning of your phone call that that we're going to be recorded, and we have to get your permission to do that. And we're going to go through a little bit of a disclosure, just again for your protection, so that you know that each broker doesn't represent every single Medicare plan that's out there, and that the scope of our conversation is going to stick to the plans that we represent. So be aware, we're not doing this because we want to be a pain. It's just we're required to do this, and it's being done for the consumer's protection.
Yeah, that's a great heads up. Thank you. So, the next thing I want to talk to you about is what about these ads that we see, right? With celebrities, former athletes, call 1-800, they rattle off some numbers, see if your zip code qualifies to save money on a Part
The
B.
bane of our existence. Yes.
What's it all about? Like, what is that all about?
Yeah. So the Joe Theismann, God love you, Jimmy Walker, like loved good times, but yeah, these guys are going on television and saying, just call with your zip code. This is a big thing. Call with your zip code and see if you qualify to save money on your Part B premium, because the government could be paying all of it for you and blah, blah, blah. Okay. What this is, every insurance carrier out there, just about all of them, are, as of a couple of years ago, introduced plans that are called Part B give back plans. So in Western New York, you've got several carriers that are offering at least one plan in their portfolio that gives you some money back in your Part B. And it could change. It could be, $50 with one company. It could be $30 with another company. The only qualification you need is to be eligible for Medicare, live in the service area. So that's why they're asking for your zip code, live in the service area where the plan is offered, and that's it, and enroll in the plan. So, it comes across like I'm enrolled in my plan, which I really like. I don't want to make a change to my plan, but gee, I want to find out if I qualify for, this extra money. And what you wind up doing is calling this, 800 number call center in God knows where, USA, maybe USA, and talking to somebody who is incentivized to make you change your plan into something else.
Sure.
So they aren't functioning in the best interest of the consumer. And this is one of the reasons why CMS implemented this call recording requirement, because they're trying to weed out the bad actors who are, leading people down a path that they don't necessarily want to go down. So yeah, it's nothing special. This Part B give back plan, I work with all of the, with these plans in Western New York that offer the Part B give back. Now, there is actually, for people who are financially eligible, there is what's called the MSP, or Medicare Savings Program, and that the federal government could actually help out with your Part B premium if you meet certain income requirements. If you're interested in that, if you think you might qualify for that, contact your local senior services department. Okay, so they are the folks who are going to be able to assist you in applying for the Medicare Savings Program. So is it Erie County Department of Senior Services, Niagara County Office for the Aging, wherever you live, there is somebody there that can assist. But surely an insurance company is just going to be talking to you about these give back plans.
Okay. All right. Thank you.
Be careful. Be careful.
Yeah, no, that's important. So, okay. So in our line of work, right? So Jeff and I's main focus is retirement income distribution planning, right?
Sure.
So a lot of times we have clients who either, prior to 65 or even when they turn 65, they're retiring, and on paper, they may have sizable assets, right? And maybe IRAs and things like that. But sometimes they've done a really good job saving in non-taxable vehicles as well. And one of their biggest concerns is obviously health insurance, right? Is how much is it
Sure.
going to cost me? What am I going to foot the bill? So, one of the things that we've worked together on, Paul, which has been great,
Mm-hmm.
is helping some of these clients figure out like, hey, there are some ways because you did do a good job saving and because you have these different assets, there's some kind of creative things that we can do to be able to help get you in potentially a lower cost or maybe no
Mm-hmm.
cost plan, even though on paper you have assets that you've saved. So can you
Sure.
explain a little bit about kind of how those low cost plans
Mhm.
work? There's a little bit of a stigma, I think, of is it good insurance? Am I
Mm.
giving up anything if I go on that? Just if you could talk about that, I think that would be really helpful.
Absolutely. So, the other hat that I wear is working in the New York State marketplace. So, you've heard of the Affordable Care Act. The federal government said to the states, you can either join healthcare.gov or you can do your own thing. Of course, New York, being New York, said, hey, we're going to do our own thing. So, this is the New York State of Health. And honestly, since the pandemic, the threshold to qualify for assistance raised. So it traditionally, if you were earning over 400% of the federal poverty level, you were taking yourself out of qualifications for any kind of financial help. However, those thresholds that rose. So in 2022, the federal poverty level, about 51,500 is where you get into 400% of the federal poverty level. You can be earning over that and qualify for what's called an advanced premium tax credit, which would lower the cost of a qualified health plan through the marketplace. Now, what they take into consideration, and you're mentioning assets, they're really just looking at your income. So they're looking at your modified adjusted gross income. So what that means, if you're collecting Social Security, they're counting both the taxable and non-taxable portion of your Social Security. So it's not just straight adjusted gross. There is a little bit more that is counted. Interest on foreign investments, things like that, that does count towards your income. But what they base your eligibility on is the income for the year that you're applying. So they're not looking back at what you earned in 2021 or anything like that. If you're applying in 2022, they want the projection of your income for 2022. And they're going to look at just, income from your job, your gross income. They will look at your Social Security. They'll look at unemployment, and draws off of investments. So not if you have money sitting in an IRA or 401k, it's actually what you're bringing in. So if your assets are safely, tucked away, or you've got a good amount of savings, they're not looking at that. They're just looking at the income. And there are people who, as you said, did some really good planning and qualify for something as amazing as the Essential Health Plan. So the Essential Health Plan, in 2022, if you're a single adult and your MAGI or modified adjusted gross is under 27,180, you're eligible for the Essential Health Plan, which is a zero premium, zero deductible, very low copays as you use your insurance. You have the choice of several different carriers, so you want to check and make sure your doctors participate. But yeah, for a household of two, for a household of one, 27,180, household of two, 36,620. If your demonstrable income is significantly below that, then we may even be talking about a Medicaid eligibility. And quite frankly, I've had successful business owners who, once they write off all their business expenses, their demonstrable income is is quite low and qualify for Medicaid.
Yeah, I think
It
that's
happens,
that's like one of the biggest, right? Yeah, we when
Yeah.
we when we're doing planning, we're looking at, I mean, that's a big expense that especially if someone's retiring prior
Oh,
to
sure.
65, can make a huge difference. And,
Hmm.
if they've done, even if they just have money in savings that maybe they can use to supplement with their Social Security and kind of
Right.
like you said, keep those IRAs and those other things tucked
Yeah.
away until they hit that 65 age,
Hmm.
make a huge difference. So that's awesome.
Absolutely.
Thanks.
Yeah, absolutely. So it definitely pays to take a look and see what
Great.
you qualify for. Yeah.
Yeah, and you've been a great partner, Paula, in being able to
Yeah.
kind of work with us and help clients to figure out, okay, what do we need to do, right? Where can we take income from and where can we show stuff on paper to
Sure.
make sure that we can still qualify for what we need?
Yeah, and we can do a lot of research without creating accounts on the marketplace or getting too far into it, just sort of taking a look, talking about the thresholds and what counts.
Perfect. So I know personally when, it comes to our clients, we're happy to send them your way and give that
Yeah,
introduction.
I
For those
appreciate
people
that.
that,
Yeah.
for those people that might be tuning in though, who, aren't a client yet, or maybe just are watching
Mhm,
this on LinkedIn or something like that. If they wanted to tap in and ask you
mhm.
some questions, what's the best way to do that? Is there a cost to that? Can you just tie that up with that? That'd be great.
Yeah, I sort of look at myself as like a personal shopper in a way, but there's no fee to work with me. So you're going to get personalized guidance. I will take the time to either talk to you by phone. We can do Zoom meetings, Microsoft Teams, or we can meet. I'm very portable, I like to say. So we can meet you where you're comfortable and just do a review of your situation. And I have a lot of folks to say, well, I'm not Medicare eligible yet. Well, you probably have a parent who is. And if they haven't taken the time to review, if you have a family member, somebody you care about that you want to take a look, I'm happy to do that. There is no cost for my services. And I'm available by phone, probably the easiest way to get a hold of me, 716-362-7316, or you can shoot me an email at pvenay@walshduffield.com. Or if you just go to the Walsh Duffield website and click on the Medicare link, there's a little contact thing that you can send us so that I can reach out to you. Just know that I cannot make an outbound call to you unless you call me first. Okay. And that's true for anybody who does what I do. So if somebody's calling you out of the blue, they're not allowed to do that. So the power is really with the consumer to give permission for those interactions.
Wonderful. Thank you, Paula. Yeah, and we'll share your information as well
Great.
on our page so that if you didn't catch all that, you'll be able
Yeah.
to, maybe copy and paste and reach out to her. You're welcome to reach out to us to figure out, how this kind of plays into your overall plan so that we
Mhm.
can work together. That's a big thing that Jeff and I do, which is, reach out with different professionals out there in different, types of industries, whether it be accountants or Medicare planning, estate planning. We can do better when we work together. And that's what this is
Absolutely.
all about. So again, thank you, Paula.
Thank you.
Please continue to, follow us, subscribe to our channel. And as always, go Bills.